my sad story. I'm shot in the chest and I know I must die.
Good morning, everybody. We're going to get back on schedule so that we can, I know we have several good speakers coming up, and we want to make sure we don't keep you longer than what we have to. Our next speaker is a licensed clinical social worker who has been practicing in the field of social work for almost 20 years. She's too young to be practicing that long, but she probably started when she was 12. Currently, she's an assistant professor of social work at the University of Texas Pan American and is responsible for coordinating the Distance Education Collaborative Program with Laredo Community College, which is something fairly new to our community, and I think she has done an outstanding job. She also has a private practice and provides counseling services to individuals and families. Dr. Longoria graduated with a Bachelor of Arts and a Master's of Science in Social Work from the University of Texas at Austin, and she graduated with a PhD in Education from Capella University in 2010. She has done a lot of wonderful community service in our community. She currently serves on the board of Voz de Niños and Communities in Schools. And whenever I can, I always go and get her, and she always brings us out of a hole and provides wonderful experience and knowledge that she has, and she comes and is always willing to share with us. So please give her a round of applause, Dr. Longoria.
Thank you, Julie. You're very kind. Well, good morning, everyone. I have prepared a short presentation on working with Alzheimer's patients and their families. As I'm sure I listened to part of Dr. Reina's presentation this morning, and certainly it exemplifies some of the many difficulties that we experience when working with Alzheimer's patients. And so my presentation is really focused on trying to help people deal with some of the difficulties that we see. It's a very, very difficult disease to watch, especially if you've had a loved one who has been diagnosed with Alzheimer's. Of course, you know that it can be very difficult to watch as the disease progresses. So hopefully this morning I'll be able to give you some ideas in terms of some of the things that can be helpful.
It's the bottom ones. Yeah.
Thank you. Sorry about that. Okay. First and foremost, of course, and many of you, I'm sure, are here today because you want to learn more about it. And that's the first thing that we need to do is to learn more, not just about the disease, but also how it affects our loved ones. You know, oftentimes, especially in the beginning stages, loved ones kind of have an idea of what's going on, and they recognize some of the symptoms, and of course it can be very scary for them. So it's a really good idea to really start trying to understand how do they perceive it, how are they dealing with some of these changes that they might be experiencing. So we can have that perspective from them. We want to make sure that we allow the patient to participate as much as possible in their own care, especially at the beginning stages when individuals still have a good sense of what's happening. They can still make some decisions about how they want to be treated, what they would like to see happen, what they would like to see not happen. And of course, it makes it much better so that we can take some of those things into consideration. It's important to allow them to talk about some of the challenges that they see in terms of dealing with the changes that the challenges that they see with the changes that they're experiencing, because again, it can be very scary for them. All right. do some research. And the first thing that we can do is talk to the healthcare provider. Ask the healthcare provider questions. Don't be afraid to find out a little bit more. What's expected? What can we see? What is normal? What's not normal? And by normal, I'm saying, under the circumstances, of course, because in and of itself, it may not feel like, well, this is normal behavior. But within the constraints of the disease, it may be that that's something that's going to be expected. So we want to get more information. We want to take some time to read about the disease. There's information in many, many, many different places. Of course, the internet, no doubt, has a lot of information. Checking in to see if there are any local support groups and finding out, what have other people done? What have other people experienced? How have they handled the situation? Those are some of the things that we want to find out. We want to find out about potential side effects of any medications. If the individual is having to take new medications, as I'm sure we all know, medications affect everyone differently. And so what you might see as side effects with one person, it may not happen with another, but it's important to find out, is that something, or is this something else that we need to be concerned about? So we want to get that information. When talking to the doctor, some of the more specific things that we might want to ask the doctor are, what are some of the ways that we can make sure that the person stays as calm as possible? Because sometimes when the individual starts to see that, they can't remember, they're not sure what happened, that kind of thing, of course they begin to get agitated because they're frustrated, not sure, not understanding what's going on. So what are some of the ways that we can ensure and help them calm down, help them stay oriented as much as possible so that they still know who they are, where they are, what the gait is, that kind of thing. And it can be simple things like just kind of asking them and reviewing that with them on a regular basis. We can also talk to the healthcare provider about how to make grooming and dressing easier. Sometimes that can become an issue. Not unlike the way that it can be with younger children. Rather than fighting it, like, okay, what is it that you would like to wear? Maybe helping them have just maybe two choices and then two options for outfits. Would you like to wear this or would you like to wear this? And then the person can still be part of that decision making. And grooming, same thing. Providing some of these little reminders, encouraging them, providing some of that patience that they need. And again, how to talk and communicate with them. How to talk and communicate with them so that we can keep that level of agitation down, keep them calm, and have them be part of their own experience as much as possible so that it isn't somebody else that's just doing everything for them. We can talk to the provider about how to help with memory loss, how to help the individual deal with some of the things that they are forgetting, because that is often what I think is most frustrating. And then how to manage any behaviors or sleep problems. We can talk to the provider ask for ideas. We can also talk to, again, other caregivers, people in support groups who might have tried some different things, who might have some different ideas for how to work with their loved ones. So more specifically, let's talk a little bit about some helpful tips for dealing with individuals who have Alzheimer's disease. And the first is the legal one. And the reason that I put this first is because, I talked about really wanting to get an idea of what it is that the individual wants. And when we see that some of the signs are first happening, or even before that, it's probably a good idea, it is a good idea to do this with anyone. It's always taking a look at advanced directives. What is it that the individual would like? In the event that something happens, and this person is no longer able to make decisions on their own, what is it that they would like to do? What is it that they would like to have happen? What is it that they would like to not have happen? really look at advanced directives, looking at the power of attorney, both medical and legal, so that the person can make as many decisions as possible for themselves in terms of their care. I teach social work, and this is one of the things that I talk to my students about when we're talking about advanced directives, that oftentimes that is probably the greatest gift that any one of us can give our children, because it really takes that burden off of the children having to decide what would mom and dad want, how would they want us to handle this. We never talked about if this happened, how are we going to do this, where would they go, what do we do. So it's really important to make sure that as soon as possible we try and take care of those advanced directives so that it's what the individual wants and not leave it up to someone else's discretion. At home, some of the things that we want to be sure is that we have things that are familiar to the individual. Familiarity is very, very important. It's important that we keep things simple and similar to what they've always known or been familiar with as much as possible. Change is what's difficult for individuals with Alzheimer's. We want to make sure that we always keep lights on at night, because sometimes, of course, there is some tendency to wander. Just for safety as well, just to keep some lights on at night. We can use reminders, little notes, lists, etc. Things that just remind you, brush your teeth, wash your hands. Depending on the severity of the illness, depending on the stage where that individual is, they may need more directives than others. And you may see that it progresses. But if they're still able to read and comprehend, then lists and just little reminders can be really helpful. I mean, come on, most of us could probably benefit from having lists. I know I could definitely benefit from having lists sometimes, because otherwise I'll forget what I'm doing. But it gives them some direction for the daily activities, if they can kind of have like, oh yes, I need to do this, I need to do this, I need to do this. And that helps keep it structured, helps empower them to feel like, okay, I have the ability to make decisions for myself, and it keeps them active and involved much longer. If we have any kind of schedules, it's important to keep them simple and consistent. Again, structure, familiarity is very, very important. If, for example, breakfast is every day at 8:30, and then going for a walk at 9:30, and then maybe, I don't know, going out to HB, or going out for a drive around the neighborhood, around the city. Whatever the schedule is, it's a good idea to try and keep it as consistent as possible. Doctor's appointments, scheduling them in the morning is going to be a good idea, just because they tend to feel more rested and a little bit more focused, and so maybe scheduling not super early, but at least sometime in the morning, maybe trying to keep that schedule as simple as possible. In terms of health, as I mentioned, there does tend to be some wandering that happens, and so if the individual has a regular walking schedule, that can be helpful, because it can just kind of take that time away, so that they get that exercise and kind of get some of that restlessness out of their system, and then be able to fit it so that if it does become part of that regular schedule, it can be really helpful in preventing some of that wandering, so that they've kind of gotten that energy out. Using some calming music can often help in terms of keeping some of that agitation down. It also can help with sleep. You know, just something that's soothing and calm, just to kind of set the mood. I mean, that's probably true for most people, so definitely for individuals with Alzheimer's disease. The next is having the patient have regular eye and ear checkups. If it's very difficult to hear or very difficult to see something, that's just going to add to the frustration. You know, because it's one thing to be forgetting or not understanding, you know, not comprehending, but then in addition to that, not even being able to hear. So it's very important that those eye and ear checkups be regular so that the individual doesn't have that added frustration. In terms of safety, there are several things. One is becoming familiar, you know, what to do if choking should occur, you know, what's the best way to handle that, you know, and generally that's going to be some of your typical, like the hybrid maneuver and things like that. Not a bad idea to be trained in first aid and you know, just to be able to provide some of that care should something like that happen. It's important to learn as much as possible about safety, both in the home and in public places. You know, a lot of that has to do with making sure that there isn't any clutter, making sure there aren't cords all over the place, trying to keep as much clear space as possible. Again, going back to the wandering, you know, sometimes if there's a lot of clutter, there's cords here and there, things going on the floor, you know, it can create a hazardous environment for the individual. So it's important to try and prevent some of those things. Learning about bathroom safety, making sure that they have what they need. You know, if they need handlebars for showering, some of the higher commodes, if they need a bench in the shower, depending on what their needs are, of course, physically, but just to be able to take care of some of those things. And then also being careful about some of the things that are left out, like medications. You want to make sure that medications are secured, you know, where they're not easily accessible. And again, depending on the severity of the disease, if the individual is not able to distinguish between medications anymore, what they're for, or when they should be taken, then definitely we want to make sure that they're not easily accessible to the individual. It's a good idea to have some kind of an ID bracelet or something that identifies the person together with a contact number, because if they do wander off, you know, you want to be sure that someone's going to be able to identify them, who they are, who to contact, should something like that happen. It's very scary when an individual wanders off and there's no ID, no way of knowing who they are, and you know, and then of course, oftentimes what happens is because they're scared and because now they have no idea where they are, they become even more agitated and it becomes even more difficult to remember any kind of identifying information. So having an ID bracelet or something that they can wear on them is generally going to be a good idea. And of course, not allowing the individual to drive. That one can be a tough one. It's not an easy task to accomplish. I know personally, my grandfather was diagnosed with Alzheimer's, and he had wandered off in the vehicle at one point, and saying you're not going to be able to drive anymore was very, very difficult. But you know, there was kind of some negotiation in terms of, okay, well, you know, we need, because his big concern was who's going to go pay my bills? Who's going to do the things that I need to do because I need to get around? And so there was, of course, some negotiation in terms of, okay, we can schedule on this day, this day, this day. Somebody will be available to make sure that you're able to take these things, etc. But driving was no longer negotiable because what happened with him was that he wandered off and he ended up, before the Mines Road was so developed, he ended up off somewhere on Mines Road. My family was, like several of my family members were out of town and we couldn't remember anything. Somehow or another, fortunately, it so happened that the police officer that found him knew my family and finally they pieced things together and so they were able to contact my mother. But it's very scary when something like that happens. So, you know, it's not, you can negotiate some of the pieces of it in terms of how it's going to be handled, but the driving is not negotiable. So. Eating. Eating is a very important factor because sometimes individuals will forget if they ate, they'll forget, or, you know, so they may end up eating several times, or they may not eat at all, or it varies because they won't remember. So it's important to supervise when they are having a meal, when they are drinking something, just to ensure that it's, you know, that it's what they need to be eating and drinking. It's probably going to be important to also talk to a healthcare provider about the possibility of meeting the extra calories. If the individual does do a lot of wandering, then you may notice that there is some weight loss because if they're not eating very much and then they're wandering quite a bit, there could definitely be some weight loss. You know, and it's not unusual for people to eat less as they grow older. You know, they may be eating less, but we want to still be sure that they're eating enough. You know, even if it's not the same, like, you know, 10 years ago or 20 years ago when they used to eat the whole burger and fries, and now they're eating half of it and some of the fries. Or, you know, that's okay, but as long as they're eating sufficient food, and that's what we need to ensure. In terms of communication, this is probably one of the most important things, and I heard Dr. Benham mention it, you know, is keeping things simple, giving one directive at a time. Because if you say, okay, make sure that you get up, brush your teeth, take a shower, put your clothes on, and be ready by 9 o'clock, probably lost. So we have to give one directive at a time. Get your clothes ready. Go ahead and brush your teeth. You know, if they're able to bathe, you know, go ahead and take a shower. You know, and things are very specific, and then give the next directive once they've completed that, because otherwise it becomes very confusing. And then of course there's going to be probably more of a tendency for them to become agitated and anxious. All the different things that they need to do when they can't remember. So keeping the directives very simple. Being attentive, you know, just really listening. What is it that they need? What is it that they're asking for? And sometimes what they're asking for may not make any sense. Sometimes what they're asking for may be very confusing. And it could be that really what they're needing is something else. For example, I have a friend who tells me frequently about his parents, and his dad will kind of start worrying that, you know, their mom went out last night and she was out all night long, and she came wearing these different clothes. I don't know where she got them, you know, and of course none of it is true. But there's some anxiety there. You know, there's some anxiety there, and so he kind of needs to kind of be reassured, everything's okay, she's here, and just kind of listening to some of that. Not to argue with them, because you're not going to get anywhere if you try to argue with them. But at least you just kind of reassure that everything's okay. And so sometimes that's pretty much what they're needing, is some of that reassurance. Speaking clearly and naturally to them. You know, Alzheimer's doesn't necessarily mean that there's a hearing problem. I mean, there might be, but it doesn't. Just saying it louder isn't going to make them do what it is that you want them to do. You know, we still just need to speak to them and respectfully. And I think that's a very important piece, is speaking to them respectfully. Because there may be issues, there may be some things that like make absolutely no sense, but they're still adults, and this is a disease, and this is something that, you know, I think is important for us to remember. You know, just speaking to them naturally and respectfully. It is best to rephrase rather than repeat, because sometimes maybe they didn't understand it the way, you know, the way that we said it the first time, and they might need to hear it a different way, and then it will make sense to them. So instead of just repeating the same thing that we just said, it's going to be more helpful to rephrase it and say it differently. And we might have to do that several times. It might not just be one time. It might not just be 2 times. It might have to be more than that. But you know, just staying patient and staying calm, of course, the entire time. Minimizing background noise. When there's a lot of activity and a lot of noise, of course, you make it more difficult for them to hear, more difficult to focus and concentrate on what they're being told or asked, or, you know, whatever it is that's happening. It's going to be a lot more difficult when there's so much activity going on. So keeping background noise to a minimum, it can be very helpful. Using answers as questions. For example, you know, if the individual is having a difficult time trying to figure out, okay, what is it that I want to do, what is it that I want to say, but you can have an agreement. Did you need to use the bathroom? Are you hungry? Are you ready to eat? You know, things like that, so that they can just, it's in the form of a question, but if you're pretty much sure that that's what it is, or it kind of helps them, okay, yes, that's what it is. That's the thing that I needed. That's the thing that I wanted. So it can be helpful that way, by using answers as questions. Interpersonally, and this is probably one of the most important, they're all important, but this one's probably really, really important, is that it's not personal. Sometimes I've had friends, I've had clients, and colleagues, etc., who said to me, now they're super aggressive, now they're always like saying all these bad words, and they're telling me off, and they're telling the nurses off, and they're telling the doctor, and this kind of stuff. Like, but it's not personal. It's part of the disease. You know, things that people, like I've had friends who say, you know, I never heard my father say one bad word in his life, and now that's all that comes out of his mouth. It's not unusual, you know. Sometimes those inhibitions are, remember, at an all-time low. So there's no inhibitions there. So now it's like, boom. They probably will say many things that you never would have imagined would come out of their mouth. And they might also be, you know, like I was saying earlier about my friend that, you know, says, you know, the dad is saying, your mom, she went out and she was bringing all these clothes. You know, one time with, there was now a clown suit here in the house, and I don't know where it came from, and now she got all rid of all her clothes, which is probably remembering clothes from way before, and he's not seeing them in the house now. But it's like accusations, accusations. And of course, she gets all agitated, like, hey, he's accusing me of things, you know, and responds to that, and so then it becomes a bigger issue between the two of them. So it's important to remember that it's not personal. It's part of the disease, and rather than trying to argue, just kind of go with it, you know, reassure them, offer that reassurance, change the subject gently so that the focus is on something else, rather than trying to talk them out of it. Well, no, I wasn't out. No, I wasn't, you know. It's going to be an uphill and lost battle. So it's better to just try to remain patient and calm, remember it's not personal, and just offer the reassurance that it is that they're looking for. So let's talk a little bit about what to do. I have two scenarios here for you. The first one is about G, who's a 91-year-old male. He's been diagnosed with Alzheimer's disease. He's married to L, who's 85 years old, and they both have a provider who assists them with the activities of daily, the bathing and the grooming, making sure that they have something to eat. One of G's sons lives next door, therefore he checks on them frequently. On several occasions, G has asked his son to get a bat and or a hammer for him because he has seen people hanging out around the house at night and he wants to protect himself. How should G's son handle this? Are there mics available for people to respond here? Okay. What do you think are some options? What are some of the things that we would need to consider or look at? Anyone?
Is it safe to give them a hammer or
To give them?
anything like that? Is it safe?
To give them the hammer? You're saying? To give them the hammer?
Yes.
Okay. What might be the danger of giving them what they're asking for, the bat or the hammer? There's a possibility that they could hurt themselves. Yeah.
Or their loved ones.
I'm sorry?
Or their loved ones.
Or their loved one. Yeah. Yeah, definitely. What do you think this is about?
It's about reassurance.
They need reassurance, probably, that they're safe, that they're okay, that if they need something, somebody's going to be able to help them. Somebody's going to be there to provide some help for them. That's probably what he's really looking for.
But in an incident like this, how would you go ahead and tell your father or that he shouldn't have a hammer or anything like this?
You can hear them out, and let them talk about, what are some of the reasons that you want this, and then redirect them into, well, what are some of the ways that you are safe? What are some of the things that you can do at night to make sure that even if there are people outside, they're not going to bother you? What are some of the things that you can do? And kind of talking to them and redirecting them away from that option.
Because a hammer could be very dangerous.
As good as the bat.
It's a weapon.
As good as the bat. Yes, definitely. It could be very dangerous. Yeah, because you're right. I mean, they could end up hurting themselves inadvertently, and or try to use it on someone else. In a moment of
Fear.
Yeah, exactly. Or even just if they're disoriented, agitated, not knowing what's going on, react that way and just act out.
But usually they kind of forget if they ask for the hammer, right?
I'm sorry.
When they forget about the hammer later on.
Sometimes, a lot of the time, yes. You kind of see both. I've seen both. Sometimes just that redirection and trying to get them focused on something else will be really helpful. Sometimes people will kind of come back to that, but then you can redirect them again. And that usually, that might be something that kind of stays in their mind. Not so much at that moment, but maybe at a later time. Other thoughts? Okay, let's move on to the second one then. The second one, we have Jay, who is a 67-year-old widow who used to live alone. Her son and her daughter-in-law live in another city, and they decided to have her move in with them. Jay has been losing weight, and she has been very distracted lately. Last night, she left the house unnoticed, and she was picked up by the police, who found her wandering and lost in the neighborhood. What should Jay's son and daughter-in-law do? what might be some options to handle this situation? Do we know that it's Alzheimer's?
So no, we don't know.
No, we don't. We don't know that that's what it is. So what might be one of the first things that we would want to do?
Secure the doors. Secure the door
Uh-huh.
so they won't leave.
Okay, yeah, definitely we would want to end up doing that, securing the door. Mhm.
Having someone to be with that person at night.
Okay, try to be able to provide some care at night. What else?
Seek medical attention, see what's going on.
Seek some medical attention, definitely. These are some things that we would want to start looking into, what's happening, what's going on for this person. We don't know yet what's going on, because they were living alone, they were fine. For whatever reason, the son and daughter-in-law decided, okay, why don't you come and live with us, but that doesn't necessarily mean that it's Alzheimer's. So definitely seeking some medical attention and trying to see, what's going on, how come this person is losing weight, what's the distractedness about, and are there other symptoms that maybe haven't been noticed yet? So yeah, definitely. Other thoughts?
Sometimes, well, I know with our dad, we made our neighbors aware of the situation so that if they saw him wandering or whatever, they knew, okay, he's got a condition, what's going on, this is where he lives, and you take him.
Great
So
idea, yeah.
make your,
yeah.
live around your area aware of the situation.
Yes, because, that's a really good point, because that does happen sometimes when, people will see something that might be alarming, but the reaction might be like, no, I don't want to get involved, I don't want to say anything, it's not even my business. So, but if you can let them know, then they can already be aware of that and know, like, okay, hey, if their parent is wandering around, or if I see that they're eating, at least let you know, so that you can say, oh yeah, I know where they're going, or, thank you for telling me, because they weren't supposed to be heading anywhere. So that's a very good point, making other people aware, especially in the surrounding area. Very good idea. Other?
Well, once we found out that it was Alzheimer's and we had the situation was very real, we started securing the doors, put locks on the inside of the house, so he would be able to get out. And that gave us peace of mind, because like with me, I took care of it for a while by myself. And after being tired without sleep or anything, there was one incident where he went into the shower, turned on the hot water, and he burned himself. And wound up in the hospital because I fell asleep. And what I did, I put a lock on my bedroom door because we still slept in the same bed. I secured the room by putting a deadbolt inside my bedroom door. That way he wouldn't be able to get out anymore.
Yeah.
At least I would have time to get up if I fell asleep again, and it would be okay. But there's just things that you do as you learn what the real problem is.
Right.
It's just things you deal with one at a time as it comes.
And like you said, you kind of learn as almost as you go along, because and that's why it's important to talk to the doctor as much as possible to find out, what are some of the things that we can kind of expect, because I think that's one of the things that's scary for people, is that you suddenly see these behaviors and thinking, what are we going to do? And again, they're normal within the context of the disease. So, okay, how do we handle them then? If this is what's going to be happening, let's figure out a way, let's learn a way to be able to handle them, something that we can do about them, because it's going to be kind of expected. It's not going to be the one time, or it might be the one time, but in all likelihood it's going to continue. So how can we make sure that it's addressed?
Yeah, and after he burned himself, we actually had to, the way the bathroom was built, we were able to set up a barrier, so he would go into the shower area again, and have possibly the same thing happen again. They're just measures that you take as the situations arise, and do whatever you have to do.
Sometimes they do need 24/7 care, and that's something that I want to talk about in a few minutes, because sometimes it is difficult to recognize that and know what to do about that. So we'll talk about that in a few minutes. Yes, ma'am.
Well, we must suspect neglect senior because her roaming in the neighborhood and her lost way.
That you would suspect neglect
Yes.
in the situation?
Maybe we must alert.
It would be important to consider
Yes.
that possibility?
Yes.
Is there another? All right, let's talk a little bit about taking care of some of these situations and you know, we need to remember that it's a progressive disease, and you know, in all likelihood, it's gonna get worse. You know, the beginning stages, we may or may not see them, you know, where we recognize that that's what's going on. There's more of a tendency to notice it when it's at the later stages. But either way, it is a progressive disease. It is going to happen at different rates for different people. And so we need to be prepared for that. And you mentioned the 24/7 care. And sometimes that is something that we need to consider. You know, it's very difficult, I know, for people to consider that sometimes. You know, because sometimes it means having to place someone in a nursing home or some other kind of environment where someone else is going to have to be taking care of them all the time. If we cannot have someone at home providing that care constantly, because it does, you know, it does wear you out, especially if everybody works and everybody has responsibilities, etc., it can make it very difficult to say, yes, I'm going to be making sure that, you know, from midnight to 7 in the morning, you know, I'm going to be awake and alert for that, and then be ready to go to work at 8. You know, it's not completely feasible or realistic to think that we can do that for, you know, an endless amount of time. So sometimes we do have to consider some of that care. Like I said, it could include some in-home care. You know, sometimes we can maybe get people who come in for shifts, things like that. It might need to be a nursing home. Adult daycares will generally provide some respite during the day for families. You know, if depending on the severity of the disease, that may be sufficient to get the individual out of the home, at least during the day, keep them busy, keep their minds focused on other things, and so that then they just are at home, you know, in the evenings and during the night. But so we really have to consider some of those things, and it's not easy sometimes for families to consider those things. I know I had a couple of friends who were living in Houston, and the mother of one of them had been diagnosed with Alzheimer's, and so they said, well, we'll just, you know, bring her over to live with us in Houston. We've got the space, we can hire someone to be here with her during the day while we're at work, etc. So it sounded like a great plan. Well, they took her, and almost on a daily basis, she was ready to go home. Because in her mind, she wasn't at home. She was visiting. She was just there for a little while to visit, you know, the caregiver, because that's the person that was there with her. It's like, okay, ya me voy para mi casa. I'm going home. Because, you know, she wasn't at home. It wasn't familiar. So what ended up happening was they did have to place her in a nursing home where she could be monitored, you know, 24/7. It was a very difficult decision to make, but under the circumstances, that was like the only option. And I see that happens for people, and there's a lot of guilty feelings about it. But sometimes that's going to be the best option. You know, I mean, from maybe some options that don't feel like they're very good ones, but you know, it's still going to be the best option. Just a few words on getting some support. For caregivers, dealing with individuals who have Alzheimer's can be very, very trying. So it's important that we get support. It's family counseling is one option, you know, where you can get some support. Asking for help from some of these agencies. And at the top, you see that Adult Protective Services is there. Adult Protective Services is really there to care and help the individual. And I know that oftentimes people kind of think of it with a negative connotation, like, oh, they're just going to create problems, they're just going to bring charges against the family, or, you know, many negative things. But in reality, Adult Protective Services can be a great resource because they're going to know about the resources that are available in the community for dealing with your loved one. So they can definitely be some help. Community resources, you know, there's support groups, or there are agencies that provide service specifically for Alzheimer's patients, etc. Really looking at all of these different options. Considering daycare, like I said, if there's a time of day when the person is able to function a little bit better, where if daycare can become a part of their daily routine, all the better. Again, remember, routine, routine, routine. And just one last note, you know, don't do it alone. It's very important to remember that caring for somebody with Alzheimer's disease can be very, very, it can really take a lot out of you. And so it's okay to ask for help. We don't have to do it by ourselves. It's okay to ask for help. And I guess, you know, I don't know if y'all can see the picture here where the people are fanning the lady on the floor. I mean, that would probably be the ideal. That may not be what we get, but if we can at least get a little bit of time alone, then that'll probably do it. So, all right. Questions?
Where would I find support groups in Laredo?
Where would you find
support groups in Laredo?
There was actually, now I've recently heard about another one. There is a support group that the last I knew was through Laredo Medical, but I'm not positive.
She's right here.
She's right there. Yeah. Okay, here we go.
She's right here. I started this support group back in 2004, right after my dad passed away. And we meet the first Tuesday of the month. We're in a month, so at 7 p.m. in the education center. Every first Tuesday of every month.
Thank you. She's ready to go. I recently heard the other one. Is that true? Are people confusing it? I'm not sure.
I haven't heard. I found one for about a month when I needed it, and then it disappeared. So I mean, I show up 5 minutes late and now we're gone. So yeah, that's why I started this.
Okay. Okay.
Through the Alzheimer's Association.
Okay, great. Okay. Other questions? Or comments? Any thoughts or anything else? Well, thank you all very much. I really appreciate the opportunity to be here, and have a wonderful afternoon.
As I walked out in the streets of Laredo, as I walked out in Laredo one day, I spied a poor cowboy wrapped up in white linen, wrapped up in white linen.